The big breaking story right now, the Union Health Ministry now asking all states to immediately increase testing. Now, the Health Ministry has said testing has declined in many states and union territories, and this must be immediately increased in a strategic manner, keeping in view the trend of case positivity in specific areas in the states and in union territories. Now, this presumably supersedes all earlier advisories on testing. Sukirti joining us with more on that big story. Sukirti, what are we hearing? What has brought this forward? You know, we've heard various messages now from experts on this, including no need to test asymptomatic contacts of those who've tested positive and so on. Does this then supersede all that? What do we know?
Well, Ankita, firstly, one needs to point out that the ICMR guidelines that had been recently released, those will continue to prevail and those rules will still be followed. However, what the government is trying to point out is that a lot of even symptomatic people were not being tested. That is what the guidelines now issued by the centre seem to indicate, because it has reiterated those guidelines in the letter that has been written from the centres and to the state governments, saying that while ICMR had issued these guidelines, even the ICMR guidelines point out that all the symptomatic people need to be tested, and everybody who is considered in the risk category, if they are contacts of these people who have been confirmed positive, then they also need to be tested. So those points will continue to prevail, and that is what state governments should continue to focus on. The centre in its letter has stated that we found that testing has gone down in several states and union territories, and it is very important that we immediately increase testing in a strategic manner, also repeating its guidelines on how areas which are clusters, areas which could end up potentially being new hotspots, densely populated areas. These are various areas of concern for which a very strategic kind of testing is required, and states need to immediately ramp it up to ensure that cases are quickly detected and isolated. So sticking to the ICMR guidelines while highlighting that symptomatic people should still be tested. That is something that, as you were pointing out, is something even being reported in Delhi earlier, that in many other places people who just had cough or other symptoms were struggling to get tested. So there have been those reports, and it seems that centre now seems to have taken cognizance of the entire issue.